We are back from our break, and we're going to get back into our budget hearing process. And I guess next up right now is Marv Duncan with the Division of Public Safety, Part 2.
Good afternoon, Commissioners. I have here today Steve Stonehouse, who's the Interim Director for Corrections, and Chris Morales, who does all the work down there. She's going to answer all the tough questions today, too. And then Mario's here. Hey, Mario. And then Dr. Rourke's over here in the corner from Forensic Science. And that's the two departments we're going to talk about this afternoon. This is Part 2 of the Public Safety Division. And so we'll get going here. The first up is the Forensic Science Center. And their mission is to provide the highest quality medical, legal, and forensic laboratory services in support of our justice system. There are 3 programs there in the Science Center: administration, forensics, and pathology. And as Dr. Roig always says, justice delayed is justice not served. So up first is administrative division in the science lab. Their purpose is to provide that technical and operational oversight to the other labs there. Who receives those services are mostly the internal staff and the public. Media, lawyers, and healthcare providers also receive services from administration. The value of this department is obviously doing the CORA and discovery order compliance, and procurement of goods and services, fiscal management, and they're also the point of contact liaison for the public. And that's all delivered by internal staff. The next program is the Forensic Laboratory Division, and their purpose is to obviously analyze the evidence that's associated with criminal activity. Who receives their services? Over 40 law enforcement agencies, fire departments, local, state, and federal prosecutors. And their value is they're a critical component of the justice system, and all that service is provided by internal staff. The next program is the pathology division. They provide the death investigations, determination and cause and manner of death. The people that receive their services are law enforcement, funeral homes, and of course the families. Their value is the criminal justice purposes, homicides and vehicular accidents, cremation permits, death certificates, needs of the family, and it's all provided by internal staff, except we have a contract vendor for body transport. So what do the property tax funds, what do you get from the lab? The Forensic Laboratory Division analyzes submitted evidence associated with that criminal activity and courtroom testimony. They provide a lot of that. Last year, over 5,000 forensic laboratory cases. They conducted over 50,000 forensic tests, 954 criminal cases in less than 60 days old. And that was a snapshot in February. Of those, there are 42 DNA cases, 545 illicit drug cases, 323 tox cases. They also were subpoenaed almost 2,000 times for expert testimony. And there are some of their performance measures down there at the bottom. The biology mean turnaround time last year was 6 weeks, projecting 12 weeks, and we'll get into that here in a little bit about the increase in that area. And then that was estimated for 2016. 2017, we're looking at the backlog taking even longer. The criminalistics drug mean turnaround time was 14 weeks in 2015. In 2016, 8 weeks, because we've got equipment that helping us out there. We've got full staff working there. And then in 2017, still projecting 8 weeks. And then toxicology turnaround time, 8 weeks last year. 8 weeks this year, and same for next year. Continuing on in the under property tax funds for 2017, the pathology division, death investigations, triage 3,417 death calls. That's a 5.4% increase over the prior year. There were 383 death scene investigations. That part of Dr. Rourke's organization is a 24/7 service. Post-mortem examinations, 895 cases evaluated. That was up 1% from the prior year. 35% of the autopsy cases are over 90 days, and there are 207 open autopsy cases. And their performance measures down below there, autopsies in less than 90 days, and 15 was 75%. Estimate 70% this year and 70% for next year. The hiring of the part-time pathologist is going to help us a lot, and he's already working in the lab. Thank you for supporting that. Dr. Rourke wants to come up next and talk about a few crime statistics and what they're doing to his labs. So, Dr. Rourke.
Good afternoon, Commissioners. As Marv mentioned, the DNA turnaround time is significantly going up, and this is related to increases in case submissions. And what I have up on this slide here is the Part 1 crimes. These are the violent crimes that occur in our area. I took some Wichita PD data to kind of illustrate the significant increase in what we're seeing. DNA laboratory touches about every violent crime that occurs within our area. And if we look at the top line, the homicide rates, if we look at the change from 2011 to 2015, up almost 15%. Homicides consume an enormous amount of resources. In one homicide case, we may evaluate 200 different pieces of evidence using DNA technology, so very cost consuming in that process. The one that we've really seen a significant jump in is the number of rape cases that are occurring in our area. And coupled with this is we're seeing an increased number of rape kit submissions. In past years, we'd get about 25% of the kits that were collected for examination. We're now seeing around 50%. That, coupled with just the tremendous increase in the number of rapes overall, is putting a significant challenge on the laboratory.
Dr. Rory?
Yes.
In the past, you say we're getting 50 as opposed to 25%. Where would those kits go previously?
They wouldn't go anywhere. They would be evaluated but not tested. They would just sit in property and evidence, either in the Sheriff's Department or in PDs.
Okay, so why are we getting them now?
That's a good question. There's a national push to do 100% testing of all sexual assault kits, with the thinking that we may be missing some unidentified perpetrator. So that's probably fueling part of the process. But just, I think, a better evaluation, looking at the cases, and law enforcement making the determination that, yes, biological evidence will be important in this particular instant. Also, change in statute of limitations. It was 5 years back in 2013. That was eliminated. So now cases can be tested or prosecuted well down the road. Getting the evidence analyzed, getting it in the system, again, will preserve and help the integrity of the investigation. Okay? And then you can look down below as far as robberies, aggravated assaults. Again, these are all up over the last 4 or 5 years. The rape kits, the trending is still going to go up, just the sheer number of rapes that are occurring and the increased submittals on that. What I also did is I said, all right, well, let's look at our peers. Let's see what Johnson County is doing, because they're the only other county crime laboratory in the state of Kansas. Homicides, Johnson County in 2014 had 9. We had 26. Rape cases, Johnson County had 137. We had 280. Robberies, 88 versus 555. And ag assaults, 555 versus 1,500 cases. If you look at the percent of violent crime in the state, Johnson County looks about 7%, whereas Sedgwick County, we look at 23% of the violent crime that occurs within the state of Kansas. We couple that with the number of staff that Johnson County has for their DNA laboratory. They have 9. We have 4. Yes, sir.
Let me just say, I know in the past we've compared ourselves to Johnson County, and I understand the point you're making, but I was at a deal and got some statistics from EMS. Johnson County is run very inefficiently. So, and I have no interest in duplicating that inefficiency in a lot of areas. That being said, point taken, but let's just remember that in the future. They're not a model to follow for in many aspects.
Okay, I can't comment on their processes, but what I was going to further say is that we look at our four FTEs we've had since 1995. Because of our efficiencies, because of the processes, the changes, some of the automation that we've been making, we've been able to keep that flat for a number of years. We've actually cut some services for DNA. We're to the point now we can't meet the needs without a little more help. And that's why I was projecting that higher turnaround time for biology cases based upon this staffing level. And then the final number, if you just break down, again, kind of illustrating the fact that we are making great utilization of our resources. If you boil down the violent crime per DNA FTE, they're working 87. We're right now doing 590. I just wanted to share those numbers with you, and that will kind of tie into our decision packages when Marv gets to that.
Thanks, Jim. So here's a look at the lab budget request. And then here it is by all funds. We did get some equipment money at the end of the year, and that helps. Next, we have the Department of Corrections, and their mission is to provide a continuum of community-based correctional services that promotes public safety, holds offenders accountable, and improves their ability to live productively and lawfully in our community. And the way we do that is listed there under programs. There's about 13 programs there, but there's one that won't be here next year, and that'll be day reporting. So Sedgwick County Drug Court, their purpose is it's a court intervention program. It's used with felony offenders with addiction issues, and who receives those services. There's an average daily population of about 108 in that program, and in last year they served about 187. I've been to drug court graduation, and those are some touching stories that these people tell. So I think it's a very good program. The value is it improves their functioning and reduces recidivism, positively impacts jail and prison populations, and the clients charged with new crimes within 6 months of graduation, there were 8 out of 38. And that's all provided by internal staff. The day reporting program, I'll go through that, or I'll skip that since we're not going to fund that after June of this year.
Marv?
Yes.
I have some questions on. I'd like to get some information on day reporting.
Okay.
I want an itemized breakdown of the expenses that we spend in day reporting. Is it all for contracts? Do we have personnel? Okay. And I want to know an itemized list of what cities are using it. Like how many people come from Wichita for their things? How many Sedgwick County processes are using? Other cities, this, that, and another. I'm a little. I thought I had a good understanding, but I want to make sure I'm not misunderstanding.
Okay.
You know, like there's no overhead for this, is there? As far as just put it all together in an email information. You follow what I'm trying to get at?
Right.
Okay.
We'll get it to you.
Thank you.
Okay. The next program is pretrial services program, and it diverts inmates from adult detention facility, and that's a good thing. And they go to their homes where they're under supervision, and many of them we use electronic monitoring on. The average daily population is 270 clients, and the number of clients served last year was 1,558. It's obviously less costly alternative to jail. The unit cost per day was $7.85, and that's all done with our internal staff. Adult Intensive Supervision Program protects the community from by closely supervising felony offenders at appropriate levels of intensity combined with programming to reduce the risk. The average daily population, 1,573, and the clients served last year were 2,820. The value is it's a less costly alternative to incarceration. The successful discharge rate from this program is 54%, and I'm told that's pretty good percentage because these are high-risk folks, and that's done with internal staff. Adult Residential Center promotes public safety through close supervision of felony offenders in a residential setting, combined with programming to reduce the risk. And the average daily population is 63, and the clients we served last year were 290. They had a successful discharge rate of 75%, which is considered very good, and that's done by internal staff. DOC administration, their purpose obviously is to support and administer planning, budgeting, implementation, monitoring of community-based offender programs for juveniles and adults. And the folks that receive their services from admin, there's 340 FTEs in corrections. And the value is they provide centralized administrative service that enables the department to fulfill its mission, and that's all done by internal staff. The training department is a consolidated department-wide training program. As you can understand, there's obviously a lot of training that goes into the employees down in corrections, how to handle folks, how to supervise folks. And again, it's 340 FTEs that receive that service, and their value is they provide professional development for the staff, and that's all done by internal staff. Juvenile Intake and Assessment Center, I know many of you probably had tours of corrections, and that's the place where there's two doors, one you go home and one you stay. And so their purpose is to intake, booking, assessment, and referral services 24 hours a day. The number of intakes they took last year was 2,817. The value is it prevents youth from getting more deeply involved into the juvenile justice system. 70% of the youth identified as having elevated risk accept referrals to get into programs, and that's all taken care of with internal staff as well. The juvenile services contract is KDOT Juvenile Services provides an annual block grant to provide prevention and early intervention, and and it's available to all the youth that are qualified for the services. And the value it adds is the county selects the agencies that effectively address the risk factors for the future delinquency, and as prioritized in the community comprehensive plan. That's a contracted service. Juvenile field services. Within juvenile field service, you have juvenile intensive supervision program, and you also have the juvenile case management program. And last year, the average daily population in the intensive supervision program was 146, and in the case management was 261, and then the clients served are there. Intensive supervision 345 and case management 453. The program operates with emphasis on these 5 priorities that you see there: safety, preventing future offenses, education, employment, enhancing an impact an engaged family can have on a youth's current and future behavior, and that's all done with internal staff. The JDF, which is most of us know and think of when we talk about corrections, is a 24-hour facility. Their average daily population is 64, and last year they had 1,143 clients. And their value is that they hold the court-ordered juveniles in a safe environment for court hearings and sanctions, and 91% of the juveniles reported feeling safe there, and that's all provided with internal staff. The juvenile residential facility, the purpose is to have a secure facility that provides less costly alternatives to the secure detention. Actually, these folks actually get to go to school. They get on a bus and go to school every day. Their average daily population is about 17, and last year we served 322 folks. And their value is serving these juveniles under detention court orders, and their average stay is about 20, and that's all provided by internal staff. SCIP, Sedgwick County Youth Program, purpose is a residential reentry program to prepare and assist male juvenile offenders to transition back into the community. Their average daily population is 17, and they served 86 last year, and they had an employment rate of 92%, and that's all provided with internal staff. The next one I think you're very well aware of, and that was the Judge Rydell Boys and Girls Alternative Program that we put together to take out to youth that are served in other homes around the county. And in fact, they're going to have a graduation for them toward the last part of this month. The youth served, 63 so far. This is a program just started right before Christmas. 55 males and 8 females, and they adopted the best practice family engagement model to work with these folks. And that's provided by internal staff and some contracted providers as well. So for 2017 property tax funds, what do we get? Adult services that provide all the alternatives to jail and community correction supervision, intervention services. There are listed there all of the service levels that we think we can do next year. I'll give you a chance to read through those. And continuing on, this is the juvenile services that the 2017 property tax funds will help with. Again, they provide the detention and the alternatives in residential facilities, field services, case management for the juveniles. And here are the estimated numbers that we think will serve in 2017. And again, those are all listed there for you. Here are the non-tax funds for 2017. The adult services that provide the jail alternatives, adult intensive supervision program, 2,725 clients with almost 4 million. Adult Res Center, 280 with almost 2 million. Adult admin, and on and on. Then juvenile services, same deal. There's the programs listed down there, what we think will serve, and what we think it'll cost. Here's the corrections budget request. We also have, we too have the higher personnel costs, but there's some more to that, and it shows over here. Our revenue that we charge clients that can pay is not going up as fast as we thought it would, so we have a shortfall in revenue. At the same time, our costs are going up for intensive service or intensive supervision program and the adult res. So we got two factors at work there. Yes, sir.
Go ahead.
Now, back on 27, you included day reporting for $1 million.
Lindsay, we had 400. Do we have a whole million in there?
Within the budget, it was
Okay.
Go ahead.
If you'll recall, for 2016, we only included about half the amount we thought we would need, planning that the program would end in June. And then if there was the decision to continue with the program, we would move budget authority from the reserves to cover that remainder. So the 2017 amount that's listed here is what their budget was for 2015, which is a full
But if
year's
it goes
budget.
away, that would be eliminated. Okay, that clarifies.
Here's all funds broken down. And you can see there what's driving some of that increase in the budget. Again, we're not getting the revenues we thought we were going to get. We're not getting the grants, that full amount of the grants. The grants have gone down a little. And so there's two vectors there that are not in our favor. Efficiency stories. The first one here is for the forensic science lab. The old process is they used to dictate autopsies and microsect recorders, and I don't know, this kind of technology was way before my time. So, but they do have a new process now, and this new system is helping them generate more reports every day. So the old system, they got 4 reports done a day. New system, they get 8. And so it's improved the quality and time savings, allow for transcriptionists to assist in also doing other work down in the lab, and that's billing out for out-of-county autopsy cases and core requests. The next efficiency story is the evidence status board. In the old process, all the scientists had to go down to the evidence room, tell them what they wanted. They either waited for it to get pulled, or they had to go back to their workstation and then come back again to pick up their the evidence that they were going to work on. The new process, they have electronic evidence status board that they can put in their request, and they can monitor it from their computers, and they can work on other things while they're waiting for their evidence to be pulled. So it's alleviated congestion and improved efficiency of chain of command custody transactions, and it's also increasing the forensic testing capacity. Again, a collaborative effort between the evidence folks and the forensic scientists. Over in corrections, I wish I had thought of this stuff. This is good stuff. Pretrial use of video visitation. The old process, you had to sign out inmates on orders received from the courts by 10 a.m. The new process, they use video visitation. It reduces staff travel to the jail. It reduces jail bed days by signing out inmates in the afternoon, and because they're not doing all that traveling, they reduced 1 vehicle. So they had an average savings for the first 4 months of $4,623. The decision packages, you heard Dr. Rourke talk about DNA. He's seeing an increase there, and he's asking for $13,000 to help cover the increased cost of DNA kits. He's also looking at increased costs for the sexual assault kit submissions, and he's asking for an additional $26,000 there. You can see the chart down at the bottom. The green is 2016, the red is 2015, and blue is 2014. You can see how things started to increase last June, and they've really gotten fired up this year with turning in sexual assault kits for testing. He also is requesting forensic scientists to help out in the biology DNA lab. Again, you can see the chart down there at the bottom. The green are 2016 inputs. So he's generating quite a case backlog. And so he's asking for $87,810 to hire an extra forensic scientist for the DNA lab. So here's the total budget requests from all the departments put together. Almost 800 FTEs, and total 2017 request is $73,310,748. Overall, the division budget is very flat. Here are the decision packages in order from all of the departments. And then these are the decision packages I showed you last time. These are from other funds. And then combined, all the decision packages come to $3,477,167. And that concludes my briefing for forensic science and corrections. Are there any questions?
Yes, sir. Thank you for the presentation. Commissioner Ranzau?
Yeah, I have a question about EMS Post 6, the new one down in Derby.
Mm-hmm.
And I know we're moving along that process, but have we had any discussion with Derby since they're building a new fire station? To me, there's a couple options there. What are they doing with their old fire station? And I don't know how many vehicles are going to have a fire there, but maybe they'd be willing to let us put an EMS station there instead of a vehicle there, maybe help pay for some of the costs. You know what I'm saying? A partnership there. I think we need to entertain the same idea up northeast where we used to have an EMS guy. And we were treating fire and EMS separately, but then they do the same things. I just think there might be.
We do share one Derby station already.
So I may have my numbers confused here, but the station that's on Rock Road, I think is 81. Maybe I'm wrong on that, but station on Rock Road shares a facility with EMS.
It's their facility, and then they allow us to stay
And then
there.
there's the old we call the old fire station. I think it's Station 82, but that's out there on like Washington and close to the river. Okay, just west of K15, and they're going to close that station down. They're building a brand new station at the old 6th grade center there at the corner of Woodlawn and Madison. So they're in the process of starting the build project. They're doing the build right now on that. I'm sure they have a date on when they plan to make that move, but it's on the calendar already. So I would free again. Potentially, there's a building there on just west of K15 that might be available potentially.
Okay.
Man, I know it's, sorry, Jim, not my district, but we've had these conversations privately and publicly about. It just makes. I think we should entertain that.
In fact, it's right next door to the police headquarters for Derby.
Okay.
Right next
Well,
door.
yeah, we'll get in touch with them and see what's going on with all that and let you know.
Very good. Commissioner Peterjohn?
Yes, would you jump back to slide 31, please, Mark?
Is that the one?
Yeah. The version you've got up there on the screen is showing in brackets, which I normally take as a reduction, and okay, those numbers.
No, EMS.
Okay.
Yeah, they just showed you the difference. Are you talking what's in parents?
Yeah, and yes.
They're just showing you what the difference was between the 2 years.
The
Mhm.
dollar amounts, but okay, I would normally view that as a reduction as opposed to an increase. Those
Oh,
are
I see what you
increases.
mean. Okay.
And, okay, but the numbers are the same as here. That's. I just saw them that way and wasn't sure and wanted to take a closer look. Thank you.
Okay. Thank you.
On slide 20, can you clarify what that means? 340 departmental personnel on DOC training. Can you elaborate on that?
Yeah,
please?
DOC training is, their purpose is to make sure their staff is trained and develop training courses for their staff, actually training people. And then who receives those, that service is 340 FTEs in the corrections department.
I assumed that's what that meant, but I wanted to be
Yep.
clear. Okay.
You're right.
All right. Going back to the slide 26, the Judge Riddell Boys and Girls Alternative Program.
Yes.
Okay, so this is the first. This is the first I've heard of the success, or the actual program is actually functional. I just was waiting for the day to hear that. So this is the first I've actually seen that. I actually did get an invitation for the
Excellent.
graduation, so I want to say thank you for that. But I guess I would like to know more about that. Is there any feedback to the commissioners as to how it's working? And
Steve?
anybody want to talk about that? I would love to know more about.
Well, we think it's been going well, Commissioner. Steve Stonehouse from the Corrections Department. What's worked well is that the kids have been able to be served regardless of where they're living and staying in Sedgwick County. If they are at one of the YRC2s here in town, they get services. If they're at detention, they get services. If they're at the residential services center, they get services. The same consistent service, and when they go home, same service. So the success rate really is, if we measure at the number of kids who complete the program, is going to be very high because they're all going to get the same service. You can't run away from this because then wherever you go, we're there. We're here again. So it's been very successful that way. Last week, I think we had 2 kids out of county. I know that was
my next question.
That was a concern for the board. The majority of kids have been staying in county because we can get them a verified service here in the county, regardless of where they live.
Do you anticipate the 2 out of county? Is that going to be? Is that where we're going to stay? You think, or is it?
The new legislation takes effect July 1st, and I would expect there to even be less kids out of county than that.
That's been my concern all along, and so trying to find a solution to keep kids in county, I think, is the best model. And that's what I've been concerned about from the very beginning on this topic. So, again, I'd like to know that this is actually, we're actually getting the performance measures that we need, and trying to keep kids in county. Those are the 2 competing goals. And so, I think Commissioner Norton was next.
We now include females into some of that engagement. Yes. That's a different model. What do you suppose will happen now that the YRC2s are going to start being defunded and eliminated around the state? I mean, we were kind of early in the process of thinking this isn't going to happen, and now it's really going to happen.
Yes.
Will that push more people towards a place? Many times where services are available, that's where people gravitate to. Do you think that'll happen?
More kids moving to Sedgwick County?
Well, anytime you're service rich, whether it's homeless or medical or almost anything, people gravitate. Families may gravitate. If they've got kids that are problematic, they may say they want the services for them. What are you seeing anything there?
I think that happens especially on the abuse and neglect side. There are 600 to 700 out of county kids placed in our county. We're not responsible for those, but they still take our resources for different things. Right. Not take, but use. And then we're having to send our kids out. So lots of times we're crossing. Kansas City is bringing kids here, and we're bringing kids to Kansas City just because with the child in need of care system, we're resource rich. But with juvenile offenders, we're able to serve kids, our kids in this county, because we have this dedicated program.
Yeah.
We've been really able to focus on just our clients. And as YRC2s go away, we'll be able to be positioned to be ready to serve them because we've already had the training in these programs.
At some point, I'd like to get a little more information about all of this and Sequel and Lakeside and the different other providers, because I'm starting to hear bubblings that they're struggling and there may be some chinks in the armor at some of the other YRC2s. I'd like to, we don't have to do it now, but at some point further down the road,
Certainly.
It will affect what we're thinking about this program. I'm glad that it's successful, but I think there's going to be more dynamics that we're going to have to worry with later.
Right. Sure.
And just to make a comment on the cost of this, I think if I was to divide this out on what you are estimating for next year, it's about almost $3,500 per client, per child, if you want to call them that. And what we've had in the past, I guess, we know the $201 a day. That's our historic number, but I think we got that number down considerably from there. But let's say it is $200 a day. We had some years as much as just under $3 million a year for services, and so from $3 million down to $350,000 is a significant change. And so again, if the performance measures compete, that's great. That's my concern. Keeping kids in county, very, very, very important. So assuming we're doing those 2 things, I think this has been a good move overall. So I appreciate the good report. Commissioner Rainsaw?
Yeah, my question is, we're prepared to continue the tracking of recidivism like we did previously.
Yes.
And it'll take a while, obviously, to get the data to be able to compare, but we
Right.
have all those mechanisms still in place.
It's once they start finishing, and then we can start letting the clock run to see where they're going.
Right. Okay.
All right. Further questions from commissioners? I see no light, so I guess we are.
I'll flip a light on.
All right. Well, Commissioner Norton, go ahead.
On the Regional Forensic Science Center, what do we project in out-of-county kinds of things that are going to put pressure on us? Because there's a lot of, it seems like we're getting pressure from internal, but we serve a lot of other entities. And I'd like a little comment on that, because as resources go away in the outlying counties, they're going to rely on us more and more at our Regional Forensic Science Center. They won't rely on KBI or Johnson County.
We are getting additional requests, especially in the area of firearms examination. Right now, KBI is very thin on firearms examiners. I've been denying those because we need to take care of our own issues. The only exception I make to that right now is if it's an officer-involved shooting that they need assistance on. We have been providing for a fee for that. But right now, I've just been saying, we'd like to help, but we just don't have the resources in the crime lab side of the house. We're still doing that 1/3, 2/3 mix on our autopsy service. Once we have the full-time physician rehired, we'll have enough resources to manage that end of it, and we're covering those costs with revenue coming in.
Do we have any sense that those numbers will go down? That's just an anomaly this year or last year, but the numbers really will continue to go up every year? I guess I'm starting to think about, do we sell this as a service, as a revenue generator for our county? Because if you're turning things away, if you charge them a little upcharge on it, you can actually pay for another person in that lab if we know that that's going to sustain it. So, I don't know how you study that or understand it or project it, but we know years ago we projected that the jail population is going to be right now about 2,500, and we're maintaining about 1,400.
That's something
So
that,
if we can find a trajectory that is going to sustain us, there may be a revenue source for autopsies and some of the things that come out of the crime lab.
well, the autopsy service, I don't really project that increasing much, at least within the next 3 or 4 years. One of the small providers up in the Kansas City area, he's been talking about retiring. If that happens, then we may capture some business out of the northeast part of the state for the autopsy service. On the crime lab side of the house, KBI, as you know, did a massive expansion. They built a brand new laboratory. They're trying to fill positions. They're having some challenges with their budgets as well. I believe they had half a dozen to a dozen open positions that they're filling right now. Once they get those in place, they're relying upon some automation that we just don't have the physical footprint to handle right now. So it's something that we're keeping our eye on. Again, is it something that's going to be a big potential revenue source? At this point, I'm not, when I'm saying this point, on the 5-year horizon, I'm not predicting it, but that's something that I'm keeping in mind and monitoring it, because if it does present itself, I'll put a proposal together and come to you guys and say, here's a thought.
Same thing on the DNA side of the lab. It seems like, from talking to the DA, they rely on that evidence more and more and more to.
Oh yes, years ago it used
courtroom.
to be a luxury on many cases. Now it's an expectation. We've had a few cases where judges ordered that thou shalt do DNA testing on certain things. Throughout the country, that's happening more and more. As far as not only doing the testing, but putting time frames on it. You must have this done within X number of days, so they can keep in compliance with speedy trial requirements.
Isn't that partly because it's more reliable and it's quicker? There's new methods that you use?
The technology is a lot quicker. 15 years ago, to just do one assay, you'd be talking weeks. Now that is days, And now, understand that's to do the assay. It still takes a long time to get in the queue to get to that point where you run the assay. We're going to be talking about tomorrow some intelligent software that will help us process things even quicker. So there is some new technologies now and on the horizon that will help in that area.
All I have, Mr. Chair.
Commissioner Ranzau?
Talk to me about funding. So we have a forensics science center, so does Johnson County.
Yes, sir.
We do it for us, they do it for them. Then you have KBI that serves the whole state.
That's correct.
Now, do we send stuff to KBI?
No.
But we could.
The law enforcement could, yes.
The rest of the state sends stuff to KBI, right? And the state pays for it.
That's correct, sir.
Do we or Johnson County receive any funding from the state?
No, we do not. Not the state general fund, no.
Should we? Do we make the argument that we're offsetting some of their... That's what we're doing, right?
We're offsetting that, but also we're providing a speedier service to our local courts.
Well, I know, but let's say theoretically, if we shut this down, overnight, right? They would have. It would be their responsibility to do the whole thing.
It'd be the responsibility. They don't have the capacity to do it, but yes,
Well,
sir.
no, I understand, but okay.
The dilemma would be how long you're going to wait in the court system to get
No, I know,
about.
but in general, it's been their responsibility in the past until we decided to do it. So we're actually cost shifting a little bit. It would not be unreasonable to say, hey, you should probably help compensate a little bit. I know they have budget problems, but I'm just not thinking about the logic to it, that it makes sense that,
Right.
we've taken over a responsibility that before we had these regional facilities was really their responsibility.
With the exception of the autopsy service. The KBI does not have the ability
Okay.
to...
all
do
the
that.
other stuff, the crime lab stuff, DNA and stuff.
That's correct, sir.
Okay.
Along that line, on these sexual assault kits, I think if we look back at history, we're processing the ones that are relevant to cases that are pending. I assume that's what we're doing already. We're doing the sexual assault kits that there's people involved in our court system somewhere. We've got to get those things processed so that we can provide the evidence needed for the case to move forward. Is that correct?
Not in totality, sir. A lot of the work that we do is there is an unknown perpetrator. A perfect example was the young woman that got assaulted in the park. This case has been adjudicated, so we can talk about it. She was out jogging. Man came up to her, unknown to her, with a knife, forced her into the tree line, violently assaulted her. No idea who he was. We had that kit. We started processing that. A few weeks later, law enforcement got a tip that there was some guy lurking in the park, very similar circumstances. They approached him, got a sample from him, and we compared that and linked him to that particular assault. So this was all in the investigative portion of the case, long before anybody was charged with the crime. Once the person was charged with the crime, then there was a lot more work to be done, and ultimately it went to court.
Okay, let me ask the question differently. That seems like a case that should have been tried. You're trying to find someone, and you don't know who they are. It's an ongoing case. It's you're trying to solve the mystery, and that you need that data to hopefully fill in the data. But I understand there's some cases where, as I've heard it described, there's a confession or there has been a consensual relationship, and there doesn't seem to necessarily be a crime to be prosecuted, but there's still a sexual assault kit on the shelf. Can that kit be sent out for testing rather than us spending the time on it?
Currently, those kits are evaluated by law enforcement and aren't sent anywhere. That's why we're only getting in a portion of all the kits that are collected.
I understand that, but you want to move towards 100%. And so I'm just saying, rather than us taking on the extra pressure to do 100%, can you send out the ones that aren't seemingly as important to us right now and send them to the state and have them do the processing on those so we don't have to deal with it?
Well, those could, but one, that's not our decision. And our position here is that we're not going to do 100%. I'm saying that's a push in the nation to do 100%. We've got, in the state of Kansas, we have a team of practitioners put together. We're looking at our practices to make sure that we're doing it right, especially doing it right here in Sedgwick County. We believe we are. But we're still seeing an increased number of rapes, period, and many of those do need to be examined, and those are the ones that we're taking care of.
Okay. On that slide, I've lost where it is, but on the slide it showed a $26,000 decision package, I guess.
Yes, sir.
Okay, so slide 36. Is that going to be like overtime for existing personnel? What's that $26,000 going to be used for?
That is to buy just more DNA testing kits to handle the increased submissions. Our staff are salaried, so they don't receive overtime.
Is this a one-time cost, or is this a consumable?
This is a consumable.
Okay. And so without that, we don't have the kits needed to
To do the testing.
do the testing. All right. Commissioner Ranzo?
So why don't we start sending stuff to KBI that we want done?
Well, one, that's not our decision. If it's submitted to our laboratory, then we do the testing.
Well,
But
yeah, but if it's submitted to our laboratory, why don't we submit it to KBI?
they won't accept it from us because their policy is if a local laboratory has the capability of doing the work, then the laboratory that handles that jurisdiction does the work. But here's some of the other risk is not we, but law enforcement would have to get the kits to Topeka, so there'd be an increased cost to that customer. Also, one of the nice agreements that we have here is, we saw on one of the charts, we get all these subpoenas. We don't come and sit in court waiting to be called. We have a relationship with the district attorney that says, when you need us, give us a shout. We can be there in 15 minutes. The defense community understands this. But if you're having to compete with a witness that is in Topeka trying to get them scheduled down here, you're going to cause significant delays.
I get that, but the rest of the state has to do that.
That's true.
And so what I'm saying is, though, I mean, if they're faced with the decision of having to deal with it themselves, let's say, or maybe helping pay some of the cost, I mean, they're not going to help support us down here unless they feel like it's worth their time. I'm just thinking of ways to. You understand what I'm saying?
I don't know if I want to run that bluff with the way the state's running it right now.
Okay. Does law enforcement have the discretion to send it to them if they want to?
Yes.
Maybe we need to ask them to send that out of the 50% that doesn't go anywhere up there. All right. I'm just thinking about ways to try and, address issues. Okay.
I think that's a good thing for us to think about. I think there's an issue there that ought to be maybe an appeal to the state would make sense in this case for some subsidy to pay for what we're doing on their behalf, so to speak. So I see the argument. That would make sense to me. But any other questions from commissioners? Okay. Thank you for the presentation and good job.
All right. Thank you, gentlemen.
All right.
Thanks, Tim.
But they would. Yeah. Okay. All right. Mr. Manager, it's on the schedule. It looks like we're ready for discussion from 2 to 2:30.
Correct.
Okay. I'll open this up to the room and the commissioners. Let's talk about whatever you want to talk about. Time to discuss. Commissioner Andre, anything you want to bring up?
No, no, since you asked, I was trying to think about some of the questions that Commissioner Ranzo asked about the day reporting center. Are we planning to budget for that next year or not?
No, actually, we're not planning to budget. We had a placeholder in there as a means to give us flexibility if we changed our minds. But I actually told Lindsay not too long ago to pull it out. After our letters went out to all the agencies that we supported in that contract and told them we were out of the day reporting business.
And the major user of that asset hasn't indicated they want to fund it in any way.
They are
looking at options of how they're going to do it, but they have not indicated that they certainly would like for us to continue to pay the bill for that, but they are making other, developing other courses of action to do that.
Well, I think the program's effective for those individuals, number one, and number two, it would, the practical argument, it works out as savings for City of Wichita. I mean, it's less expensive than their alternatives, so I think they will not let that company out of town.
Anything else, Commissioner Unruh? I'll speak to that. I have asked some of the folks across the street about their intentions, and right now, all the feedback I've gotten so far is they are looking for options, but I think to pay the fees to keep it going as is probably not on the table. They're going to either do something different entirely, or they're going to. Here's our jail. I understand it may cost them more money, but that's what they told me so far. Whether it's real or not, I don't know, but that's what I've heard. So anyway.
Well, in that category of people, if they want to reduce recidivism and help things big picture and help things, I don't know what alternative. I mean, we did that because we checked out alternatives.
I have attempted a couple of times with the city manager's office to work with them on at least developing their options, but I haven't gotten a lot of feedback from it, and I know the staff has worked with them. So we've been very open with what we're doing. Even sent a letter a couple of weeks ago telling them, 30 June is the last date, but really we haven't gotten anything in return from them to discuss options.
How long is our contract with BI? We're still using behavioral interventions. How long?
Our contract ends 30 June.
Okay.
So we gave them, we sent out a letter a couple of weeks ago.
Okay.
And I think Commissioner Ranza asked earlier for some data on that. I guess I am also interested in the same data. I think it's the same data. I'm interested to know whether or not what was proposed to the users to pay that fee, whether that covers 100% of the cost, and should their numbers go up or down, how does that change? I mean, for example, if you only had 10 people in the program, I don't think that those fees would pay for everything. There's going to be overhead. But if there was a lot of people in the program, let's say there was 100 people in the program, there's going to be potentially a surplus. So I'd like to know how that breaks down in terms of, if they have their average daily population is the same as we've seen in the past, and whatever that number is the fee that was proposed to them to be paid, does that cover 100% of the cost, or are we essentially subsidizing the program to keep it moving forward? So that to me is one of my questions, and I don't fully understand that. So I'd like to just understand that deeper. Anything else from Commissioner Unruh?
I guess with the question, or is it's a per person use fee, isn't it?
That's right.
Yeah.
But that's, again, so you only have one person in the program. I don't think the model works.
Right.
You've got to have a certain number of people.
We had, I think the number is about 50. I'm not sure. But the city was working on solutions that right now they have been in a steady decline in how much they used it, and they were actually approaching the 50 threshold that would push it down below the need to have it kind of a thing. So there is an overhead associated with it, and we use it very little. So
they've already been de-escalating their use.
Correct.
So our cost should have been going down as well with that. Then from 300 down to, they're getting closer and closer to 50 then.
Correct.
Did that start last summer, or is that something that started that trend started before then?
Well, when I asked Ron to look at it, it had been over the last few months. So I'd say probably around Christmas.
And again, I think that they're beginning to wean themselves off the program potentially. So maybe that's just them reacting to the reality that's about to come to them. So
And when I addressed it with him earlier, he was looking at other options to where they would either contract with individual services or use services that didn't need, to contract for. So they were looking at doing a targeted model as opposed to a model that did everything for you, kind of thing.
We don't have any evidence that their decreased use has led to an increase in jail usage, do we?
I don't have any data on that at all.
Man, I don't recall off the top of my head that it looks like those numbers. It's certainly not gone up 300 or even 100. They haven't.
Well, aren't these folks assigned there by a judge?
Yes.
So it's like this whole usage is not just administration of Wichita's decision, it's a judge's.
Well, but they're coming from the city judge, municipal judge.
And they're the office
Yeah,
we've been
okay,
communicating
I
with. And it's that office we've been communicating with on
Okay,
plans. And they got the letter, their clerk.
okay. I didn't make it.
And I suppose they have the option of just, letting them out, or lock them up.
But not
or some type
prosecuted for
of
whatever it is.
That's another option, or provide the service some other way. So again, I think they've got a palette of options that they may be exercising some of those options already. So.
Or maybe Judge Jones is going to take him home with her. Or maybe not.
It's an option.
Anything else down here? Commissioner Norton?
Well, as I remember, day reporting and work release were kind of two of the first programs as we started that thinking about, instead of building a jail, add some programs. And, you can ride a horse for a long time and think it's the right thing. Maybe it is time for it to go away. But as I remember, that was kind of our toe in the water to look at programs as opposed to brick and mortar. And if it's not feasible or not cost efficient or not necessarily doing what we want it to do, I don't know that we have to keep going with it. But as I remember the history of it, that was one of the reasons we said, gosh, it's going to be expensive to build more jail space, so let's look at programs. And day reporting, work release, several others, intensive supervision. I don't know, Mark Masterson's not around, but he has a whole history of all those things that we did, graduated sanctions and everything. So
It seems to me it's probably morphed into doing something different than what the original intent was. And so it's not like some of the other programs I think clearly keep people out of jail, but this is just related to, seems to be used mostly by the city municipal courts.
Well, for me, it would be thinking about if it goes away, what does it do to the jail population?
Right.
And if it's 5 people a day difference, big
Right.
deal. If it's 100 people difference a day, then that's sending people out of county, and then
Right.
we go back into that same thing that we had before. So somebody knows that answer of what the trajectory would be, and if it just totally goes away at the city, what does it mean to our side of the street,
Right.
which is jail population?
Well, I'd expect CJCC folks, both the city and county, to look at it because, I will still look at, even though I don't mention them during the commission meetings like I used to, the jail population. I mean, I look at the work release things, and one of the things I'd first thought of, exactly like you mentioned, Tim, we need more work release. Well, for the last year, basically, our work release population's been about 2/3, maybe 70% of capacity. And so really, for whatever reason, and of course the judiciary on whoever's assigning those people, whether it's municipal court or district court, would be throwing it into the mix. The one program that I think really played a major role in helping on the jail population side that didn't get mentioned was pretrial services, and the average daily population is around 270. I'm thinking that's pretty close to what it's been, and that's been a pretty stable number. And I've always looked at that as an excellent tool to help on the jail population side for people, particularly the failure to appear folks who kind of struggle having their lives organized well enough and miss court dates, and then they end up getting having bench warrants put out for them and then getting pulled in. The question I might want to throw out, and I guess Marv, you're stuck because you're the only one here I'm going to look at you on it. It was mentioned in passing that on the revenue side for corrections, that there'd been a shortfall on the revenue in terms of in client revenue. I think it was tied in with your slide on slide 31. Do you have any idea if that shortfall, how significant that shortfall is, and how big that is, and are we charging too much, and people are falling out of the program because we've got it set too high? Is it set too low, or is it something else?
We think we're going to be $125,000 short this year in the client revenue.
And we projected how much total?
We projected $620,000 for this year, and we think we're only going to collect $495.
So we're
Based
about 80 or 20% short.
Based
About
on
80%.
what we've seen so far in the spring.
Any thoughts in terms of what might be policy options on in that area, Marv?
If they haven't got the money, we're going back in jail.
Well, and that's the trade-off and the challenge we have, because if, like Tim said, it's 2 or 3 people, no big deal. But if it's 100 or 200, it's a very big deal.
Well, if I may jump in here, we also know that scope and the keeping the homeless and the mentally ill out of the jail has made a huge difference. I mean, we've worked, all those programs are starting to work, the crisis center. If you think about all of those, that keeps people out of jail. For the first time in a long time, the new population of the chronic homeless is down to like 35. When I first started working on it, they were counting 120 to 150 every year. Now, the population of homeless is up a little bit, but that's families, and that's not the chronic homeless that we were having as frequent flyers in the jail. We were picking them up 3 or 4 times a year. They've been housed now. They're into other services. Certainly Scope and the Wichita HOT, is it called HOT, has made a huge difference because they're getting to other services instead of being booked into the jail. So a lot of those programs all started working about the same time as day reporting. It may be that we've just hit on some of the quotients that we needed to keep the jail population pretty stable, and it has been for several years now.
Well, that curve that I remember Bob Lamke showing, but just
2,500 right now. I looked at it.
It was growing, and then what's scary was that curve was starting to bend exponentially.
Yeah.
And the fact that we've had it is relatively flat, and the fact that we've had, and the work release side, I thought, if we were going to be bending that with problems that they were talking about of offenders, I thought that'd be one of the places where we first max out capacity-wise.
Well, I think one of the things we found out about jail population is if you could deal with the mentally ill, the homeless, and some of those outliers, not folks that had created felonies and everything, that you would really bend the curve. And I think we focused on that. I mean, I believe the mental health pod has been a real boon to us. I mean, I think that's helped because we're getting services to people, and those folks aren't becoming frequent flyers. Once they get out, have got some, and the crisis center is helping with that. Yeah.
And it's helping in other ways too.
Yeah, absolutely.
Back to my previous thought, the jail fees we charge for the users. I assume, again, there's an optimum number of people in the jail that creates, I guess my assumption is that those fees we charge are paying 100% of those people, but maybe not.
Well, I'm talking corrections fees, not jail fees.
Okay, so we charge Wichita for one of their inmates so much per hour.
Okay, I'm conflating. I had been talking about the charge shortfall that we had in terms of the charge that was for the people going into the program in corrections. And I'm maybe misunderstood. If you're talking about the fees that we charge the municipalities for misdemeanors who are in the Sedgwick County Jail, okay.
Well, anyway, this is really not tied to your question necessarily, but that hourly charge we charge for that, does that acknowledge basically there's overhead paid for by Or are they paying 100% of the cost?
No, sir. The policy that the commission has adopted imposes only the direct cost of the prisoner on the city.
Okay, direct cost. I remember that now. What is the indirect cost that's not being billed out?
Let me send you the numbers. I don't want to
Okay.
guess wrong.
I think it's important to understand that because it kind of ties into this discussion of day reporting. It's a similar discussion. I mean, I think the argument for making changes to day reporting is that they're really the same arguments about the jail fees. It's identical arguments. And so, fact of the matter is, we had not been charging for day reporting. It was widely used by other responsible governing bodies without paying for it. So I think we recognized that, wanted to shift the burden back to the people who are putting folks in there. Makes sense, but I guess I just want to understand how, if there's any overhead being paid for by Sedgwick County, how that offsets maybe some of the costs that they may not be recognizing that. So it's really kind of a similar analysis for both the jail and for the day reporting. All right. Any other questions from anyone? Okay. That's it. Let's next time we come together would be on Thursday at 9:30. We have 2 more budget hearings, and then we're done for the year. Correct? All right. So Thursday morning, 9:30. Of course, we have our meeting tomorrow at 9 o'clock. All right. Thank you. We're dismissed.